Well, as the globe marks World AIDS Day, activists in South Africa have criticised government for failing to provide ARVs to all who need it. Well, Dr. Ramneek Ahluwalia is the program director for HEAIDS, a health program directed at tertiary institutions, and he joins us now from our Pretoria studios. Good afternoon, Doctor, and thank you for your time on the PM News Desk.
Thank you, Kirshni. Thank you for having me.
Doctor, you've issued some dire warnings of complacency. Why is it critical that we turn off the tap on new infections? And are we looking at a situation where HIV/AIDS is indeed falling from the pinnacle of the global health agenda?
See, I think it's important that we do understand that today's a day that we are celebrating World AIDS Day. It's got two sides. We should celebrate or we should not celebrate. If we say we should not celebrate, yes, because we've lost millions of South Africans or millions of Africans or people in the world because of this pandemic. But on the other side, we must celebrate because we've achieved a lot into this virus from last 30 years. So I think there are two sides again. From the global health agenda, as you've rightly said, yes, I do agree with you that HIV is falling down. Many new viruses like Ebola that has just recently been into the environment is taking strides. But what we have to be careful here is that we do not lose what we have built from last 30 years. And I think HIV for me still remains one of the biggest pandemics our earth is still facing or will continue to face in the next 30 years. And I think that is what a global warning is from my side to all the leaders, that we ensure that HIV remains on the standard as to the most important arena as it was.
Doctor, locally, some slamming government here, but if we take a step back, it has made some good progress. For example, this year alone, our President and Health Minister Ramneek did some sterling work in negotiating that price reduction on HIV viral load testing across the globe. And we do have the largest HIV treatment program on the globe. We're talking about a 40% reduction in price. Tell us how significant a victory this is in the fight against HIV/AIDS.
Definitely, and I think as I started, this is the time to celebrate this achievement. 2.7 million South Africans on ARVs is a remarkable achievement in any part of in the history of HIV and AIDS. Getting price reduction, absolutely critical, and I really thank the leadership, the political will that is sitting in South Africa on grounds to ensure that we provide access of ARVs to almost everyone, as long as it's possible for the government to do it. It's very expensive, so you always remember we have new infections coming every year, every month, every day. And every new infection means it's a liability on the government to put that patient on treatment. This means that there is a cost associated to it, as far as we can lower this cost. But on the other side, I will also request the government, my request to civil societies, to everyone, is to also ensure that we prevent new infections. Let's not make new people get HIV, because every new person adding on is a cost implication to South Africa in itself. Our economy is affected. So I think in total, it's a remarkable achievement. 2.7 million South Africans is an amazing thing, and I think we must be proud of as South Africans to be able to achieve this part.
Another highlight, in July this year, the health minister announced that all pregnant HIV-positive women will go on to lifelong ARV treatment from January. Is that plan still on track? This is indeed a bold policy shift. How will it help in the fight against the pandemic?
One of the major success, Kirshni, we have ever achieved in South Africa, besides the 2.7 million South Africans on HIV ARV drugs, is the PMTCT reduction, the mother-to-child transmission reduction. And mother-to-child transmission only happens if we can start a pregnant woman on ARVs early. Treatment is always also looked as prevention. If you are having treatment, your infectivity of passing this virus to other person is less. Similarly, the vertical transmission of between mother and the child is drastically reduced once you are put on treatment. So I think it's a very bold decision. And importantly is, once the mother has delivered the child, she's going to be breastfeeding. There are also chances through that. The second important thing, she's going to be again in life becoming pregnant. She's going to be sexually active as a woman. Important thing is we have to ensure that that mother is started on ARVs. And once we have started anyone on ARVs, we continue it for many years, because it's just like, as I've always said, HIV is like any other chronic disease, like diabetes. You need to know your status early. Once you know your status, you put on treatment. You take your pills, you look after your exercise, you live as long as possible. HIV is like another chronic disease.
But doctor, there has been some controversy around this, with some clinicians cautioning the benefit to patients that has not yet been proven, and that it might indeed increase ARV resistance in a country where we know about 40% of those on ARV treatment cannot be traced after about 3 years of being on ARVs. Do they have a point, sir?
Absolutely, yes. I totally agree. How does a resistance of any virus or bacteria happens? Resistance happens is, for example, a simple layman language is when you have a bacterial infection or you have a cold, sore throat, a doctor puts you on antibiotics. And when an antibiotic is put, if you do not take your full 5 days course, you've just taken 2 days course, the bacteria itself starts becoming mutant, it starts replicating in a way that it becomes resistant to the same medication. Similarly, the same is HIV virus. We start you on treatment. You are on treatment, you stop the treatment, you don't get your drugs, you don't take your drugs. The same virus is going to start becoming resistant to the drugs we have available. First of all, this is a huge invention in our lifetime that we got ARVs. And now just imagine that the same ARVs are going to become resistant. Just exactly what we are facing with TB, when we're becoming a multi-drug resistant TB.
Yes. Doctor, the intention behind these announcements is great, but the daily stockouts we face of basic tuberculosis medicine, for that matter, ARVs, even vaccines, is a reality we face. So how crucial is it for us to focus on rectifying the widespread provincial stockouts? What we need for this to work is a functional supply chain of medicine.
Absolutely. I think you're hitting the nail, absolutely. I think very importantly is what causes stockouts. One of the reasons is that I will request is that we need to capacitate our operational managers. Sometimes the drugs are sitting in the go-downs, it's not reaching the clinics. I think that's where the operational breakdown is. When the pharmacist knows that the drugs are finishing into the clinic, immediately there should be a contingency factor in how ensuring that the drugs do reach the clinics. I think capacity development and training, making sure that every manager in this country understands who is working in those clinics and realize there's a life attached to it. We are going to cause ourselves serious problems. So I think as much as we are going to look into national issues about tender issues, ensuring that drugs do come out, pharmaceuticals provide supplies to the national spheres and the provinces, it's also about the operational managers right down into the clinics and district clinics, local clinics, where they need to understand this issue and take this job seriously. And I think once we start as South Africans taking our job seriously, these things will reduce drastically. And I think the minister is taking drastic decisions in ideal clinics towards the scenario.
Thank you, Dr. Ahluwalia, for your time on the PM News Desk. That was Dr. Ramneek Ahluwalia. He's the Program Director of HEAIDS. It's a health program directed at tertiary institutions across the country.